celebration of the fifth annual, I can't believe we're at the fifth annual already, fifth annual Hip Health Day. So as Tamara said, my name is Emily Schaefer. I am co-founder along with Keisha Mulpuri of the Hip Hop Network. And I'm the research director for orthopedics at BC Children's Hospital in Vancouver and a research associate in orthopedics at the University of British Columbia in Vancouver, BC. So as we begin, I just want to acknowledge that our work at BC Children's Hospital and at UBC takes place on the unceded, traditional, and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So I know that there are many of you joining us from across the globe, and so I would like to extend this acknowledgement, gratitude, and respect to all the communities from which you may be joining us today. And now I would just like to pass along to Dr. Keisha Mulpuri for some opening and welcome remarks.
Well, thank you, Emily, and welcome everyone. And the Hip Hop Network launched Hip Health Day in 2021 with aims to increase global awareness of hip health and to celebrate many significant contributions made towards hip health research, clinical efforts, and advocacy all around the world. We encourage groups and individuals to celebrate Hip Health Day in various ways in the shared spirit of improving hip health around the world. Today, we're thrilled to celebrate the 5th annual Hip Health Day with you. We're fortunate and grateful to have many of the world's leading hip health organizations and advocates here to share the updates on their efforts to improve hip health for children globally. Today, we have presentations from 6 organizations and advocacy groups. We will be honoring 5 hip legends who have made outstanding contributions to hip health of children, both in their own local communities, but around the world. We will be encouraging you to celebrate your hip squad. There will also be an opportunity for a group photo at the end, so stay tuned. We also welcome guests who registered from around the globe. The incredible engagement at this event highlights the impact of your efforts from local to global, back to your local communities. The hip health organizations, first, we have speakers representing, next slide, please. We have speakers representing 6 different hip health organizations. You will hear from their representatives about the meaningful work they're doing to improve hip health and mobility, local to global, and how you can get connected to learn more about their activities and ways to get involved. Next, the Hip Hop Network is an incredible network for you to come and get involved. I am now happy to introduce our first speaker from Hip Hop Network. Welcome, Joel. Joel Sloan is a managing director of the Hippie Lab, but he also leads the Hip Hop Network. Thank you, Joel.
Thank you, Kishore. And hello, everybody from around the world, and greetings. The Hip Hop Network is a global community of all types of hip health professionals with the mission to solve every hip health challenge. Launched with generous support from I'm a Hippie and the Peterson Group, the Hip Hop Network is a growing platform both for and by the professional hip health community. Provides unique opportunities for learning and connection toward advancing globally relevant capabilities and improved outcomes in hip health. On behalf of the global leadership team and action committees of the Hip Hop Network, I'm excited to share some of our latest highlights with you today. So first, the professional development is a key goal of the Hip Hop Network, which includes providing current and globally relevant education and engagement materials and events. In 2025, we launched an educational live webinar series and are hosting sessions on key topics with globally recognized leaders. The live group format allows for expert panel discussions and community engagement from around the world. It is also generating a growing library of recorded reference material. I invite you to please browse the recordings and stay tuned for upcoming topics, which include the hip and trisomy 21, open reduction of the hip in infants, and guided growth for the hip. This series is part of a larger education program that we're building out further in 2025. So stay with us as we develop even more hip health learning opportunities. Again, as Kishore mentioned, Dr. Mulpuri, bringing the global community together is at the core of what the Hip Hope Network is all about. And we're so proud and grateful to be able to initiate Hip Health Day and celebrate it with you for the 5th time now already. I wanted to take the opportunity at this special milestone to thank you all for all you do to help advance hip health for children and families around the world, and for joining us today. We're so honored and grateful. Looking forward, one key item to mention at this time is an ambitious gathering we're planning for the autumn of 2026 in Vancouver, Canada. Stemming out of popular demand at our annual in-person and hybrid all-member conferences, we're aiming to hold a special 2-day Global Hip Health Conference to provide more time for the latest research, training sessions, workshops, and more. We're sorting out the details and dates now, so please stay tuned for announcements. Finally, please do check out our website for access to a growing amount of resource materials and register free to join the community and get connected to engage with the network and stay informed about our many activities and events. Thank you again, and happy Hip Health Day.
Thanks, Joel. And so next we have a video from Candelaria Mercado on behalf of the International Perthes Study Group, or IPSG.
The International Perthes Study Group was established in 2012 by a group of surgeons and scientists with a common goal to better understand Perthes disease. So far in 2025, we have published our 3rd paper describing how adults are functioning after having Perthes disease as children. We also expect additional work to be published this year, 2 manuscripts on patient-reported outcomes and 1 manuscript on safety and feasibility of perfusion MRI. Last fall, we started Perthes Heroes Day, an event held at Scottish Rite, with the goal to create a community for Perthes patients and their families. We invited all these kids and their families to the Scottish Rite campus to enjoy a day of picnic and carnival games while engaging with others going through similar Perthes journeys. In 2025, we are planning to have a similar event again this fall. All patients are invited. They don't have to be located in Texas to participate. If you would like more information about the event, please contact ipsg@tsrh.org, or you can visit the Facebook page where we will be posting the formal announcement. And here are more ways to contact us if you are interested in the event mentioned or just have other questions relating to Perthes disease or the International Perthes Study Group.
So thank you, Candelaria, and to IPSG. So next, I'd like to welcome Lauren Scholler on behalf of Miles for Hips, who is here in person to talk about their organization.
Hi, everyone. Thank you so much for the opportunity to share about Miles for Hips. We are a patient-driven organization of individuals affected by hip dysplasia with a focus on education and empowerment, awareness and advocacy, community, and fueling participatory medicine. Next slide, please. We had a big year. First, I want to highlight our newsletter that a lot of work goes into to highlight updates from our group. So this one shows a group of our board members, our founder, Nancy, and another board member, Ashley Spala, who presented at ISHA, the Hip Preservation Society's scientific meeting last year, on effective patient inclusion and the role of peer mentor support throughout one's hip dysplasia journey. Last fall, we also launched an initiative called the Hip Dysplasia Experience, an interview series sharing patient stories with hip dysplasia and what is important to them in their care journeys. And this has been a really great initiative to amplify the patient perspective on hip dysplasia care. Those videos are available on our YouTube with shorter clips on our Instagram. Last October, we also had a successful day of movement with in-person meetups across the United States, fundraising for the International Hip Dysplasia Institute, and celebrating movement in any form for those affected by hip dysplasia. We recently held our annual Team Week, with this year's theme being hip dysplasia around the world. We interviewed surgeons and physical therapists involved in the care of those with hip dysplasia to discuss screening protocols, the typical care pathway for treatment after diagnosis, and priorities related to hip dysplasia care, research, or education in that part of the world. And this was an incredibly insightful series that captured the global perspective on hip dysplasia, and it's available on our YouTube channel. Next, we're so proud of our our Miles for Hips champions. And so to highlight our most recent one, JC Williams, she fundraised and ran the London Marathon after recovering from her hip surgeries. And finally, another major pillar of our work is our focus on patient education and creating resources for the hip dysplasia community. In the last year, Awareness Month, so be sure to keep an eye out for that. Next slide. What's next for Miles for Hips? In the spirit of the start of Hip Dysplasia Awareness Month, we have a busy month planned with numerous new educational resources, interactive activities, and events across our social media platforms. For Hip Dysplasia Awareness Month, our next community event is our annual Day of Movement taking place in October, where we look forward to seeing the creative ways the hip community celebrates how they move with hip dysplasia. Next slide, please. And this is where you can connect with us on our social media platforms, and we're very active on there, so we look forward to seeing you. Thank you.
Great. Thank you so much, Lauren, and thank you to Miles for Hips for being such a great organization and great partner. Our next speaker is Dr. Bryn Zomar, who's a research associate with the Hippie Lab, and she is going to present on the Hippie Global Registry Program.
Great, thanks, Emily. Hi, everyone. It's great to see so much involvement here. Next slide, please, Tamara. So the Hippie Global Registry Program is a group of global registries run by the Hippie Lab at BC Children's Hospital in Canada. And our aim is to enroll patients from around the world to help us address questions related to screening, diagnosis, and treatment for a variety of different conditions. We are most excited about our newest registry upcoming later this year, the Rare Hip Conditions Registry, which will be launching in the winter of 2025-2026 with 2 conditions to start with, the hip in SMA and in trisomy 21, with the hope for the future to include up to 29 different hip conditions. Next slide, please. GHCR was our first registry, the Global Hip Dysplasia Registry, started in 2016 and is focused on children with hip dysplasia and has reached almost 8,000 patients globally. We're really excited about that. We actually launched our first randomized trial just last year under the registry, assessing whether observation alone is no worse than bracing for the treatment of mild hip dysplasia in babies under 3 months. And we're very excited to begin answering some of the long-standing questions about hip dysplasia. Next slide, please. SLIP is our second registry. It's the SCIFI Longitudinal International Perspective Registry. It's focused on adolescents with slipped capital femoral epiphysis. It's launched in 2018, and we've just surpassed the 800 patients enrolled milestone earlier this year. And we're excited to be able to start answering some of the questions around SCIFI, such as assessing variability in treatments across the centers that are involved in our registry. Next, please. Global POISE is our newest registry. It's the Global Pediatric Orthopedic Implant Safety and Efficacy Registry. This launched in 2023, and it aims to assess the safety and efficacy of implants used for treating children with a number of different conditions, including trauma, limb differences, and hip conditions. We've recently surpassed 500 implants enrolled, over 300 patients, and we now just recently reached 11 centers involved in Canada, the US, and Australia. At the Hippie Lab, with these registries, we are most excited about the global impact of our registries, working with our collaborators and centers around the world to ensure that our research impacts children not only here in BC, but globally as well. Next, please. If you want to check out any about our registries or hear about the progress with our registries, please check out our website or our Instagram. Thank you.
Great. Thank you so much, Bryn, and for that recap of the Hippie Global Registry Program. And next up, we have a video submission from Dr. Pablo Castañeda from the International Hip Dysplasia Institute, or IHDI.
Hello, my name is Pablo Castañeda. I am the Medical Director of the International Hip Dysplasia Institute. Thank you for joining us today for Hip Health Day 2025 and for being a part of this global growing effort to raise awareness, improve care, and support families affected by hip dysplasia. The International Hip Dysplasia Institute is a non-profit collaborative dedicated to education, advocacy, and research. Our work reaches families, physicians, and healthcare professionals in over 200 countries. We provide accessible, evidence-informed resources in multiple languages, and we continue to serve as the leading voice for hip dysplasia education worldwide. One of our most exciting areas of growth this year has been in digital outreach. We now produce 2 podcast series to reach a broad and diverse audience. The first is called Straight from the Hip, a clinical podcast where I speak with experts from around the world about current research, surgical strategies, and innovations in care. If you're a healthcare provider or researcher, this is where we go deep into the science. The second is called Hip and Happening. It is our public-facing podcast designed for families, patients, caregivers, and it's clear, supportive, and engaging. It helps people make sense of diagnosis, treatment, options, and living with hip dysplasia. Both are available on major platforms wherever you get your podcasts. I'd like to highlight the incredible work of Valerie Parrish, who leads our patient engagement and advocacy efforts. Valerie has been instrumental in connecting with patient communities and support organizations around the world to ensure their voices are heard and their stories are elevated, their needs reflected in the work we do. This past year, IHDI partnered with CECOT, the International Society for Surgery in Orthopedics and Traumatology, to host a full-day global symposium in Belgrade, Serbia, focused on hip dysplasia. We brought together clinicians and researchers from 23 countries and all 6 inhabited continents. It was a powerful moment of exchange, learning, and momentum for the future. As we grow, I'm proud to work alongside our medical advisory group, which now includes leaders in pediatric hip, such as Dr. Simon Kelly, Dr. Salil Upasani from San Diego, and Dr. Woody Sankar from Philadelphia. Their commitment, insight, and expertise continue to grow and guide IHDI's evolution and help us set new standards for collaboration and excellence. Looking ahead, we are excited to return to Europe this year to participate in the Hip Hooray Network event and in the CEPOT event in Madrid, Spain. In 2026, we will be hosting a new surgeon skills course in partnership with the Texas Children's Musculoskeletal Institute. Thank you again for your support and for being a part of this mission. We're proud of the progress we've made and even more excited for what lies ahead. Together, we're building a stronger future for patients with hip dysplasia around the world.
Great. Thank you, Dr. Castañeda and IHDI. And now for our final speaker representing different hip health organizations, I'd like to welcome the incomparable Regina Wilkin from I'm a Hippie.
Thank you, Emily. I don't know where incomparable came from, but I'll take it. Thank you. And thank you to you and Kishore for having us today. For those who don't know, I'm a hippie. A lot of you probably have our little frogs, which I unfortunately don't have one to show. But we are a grassroots community based here in Vancouver, BC, dedicated to advancing children's hip health globally. We have had the privilege of working alongside Kishore, Emily, and the Hippie Lab over the past, I would say, 8 to 10 years. So we've had a busy past 6 to 8 months here at Hippie. We've just come off our fundraiser gala. It was really good to see the hippie community back together after 18 months. So we had a lot of our longtime supporters, and it was really good to see lots of new faces all coming together to support children's hip health. It was a good evening where we raised a nice amount of money to support both new and ongoing initiatives. We announced the Hippie Lab's creation of the Rare Hip Condition Registry, and learning from the successes of the International Hip Dysplasia Registry, this new initiative will be life-changing, for families who have to navigate the uncertainties of hip conditions that are otherwise so poorly understood. Another initiative that we are excited to share is the Row to Grow program, a first of its kind para-rowing program in BC created by the amazing team at the Motion Lab here at BC Children's Hospital. Inspired by I'm a Hippie Russell G. Smith Grant Awardee Dr. Patricia Moreno, who might be on this call today. The Road to Grow program gives teens with cerebral palsy the chance to experience the power of movement. More than sport, rowing builds confidence, strength, and connection, and a sense of belonging, proving that sports and mobility can and should be for everyone. The critical funds raised at the gala also allow us to continue our other education and awareness projects like the Hip Health campaign that's currently running and growing across hospitals in the Lower Mainland. Through these various initiatives, I feel like we really truly are making strides in ensuring that no child is left behind in our efforts to reduce the burden of a hip disorder diagnosis here in BC and globally. On behalf of I'm a Hippie, I would like to congratulate all of our hippie legends. You're an inspiration to us, and we thank you for all that you do. And a special shout out, of course, goes to our own hippie ambassador and Team Canada para hockey player, Maggie Manning. You're truly a legend, and your hippie family are always proud of you. And lastly, please connect with us. There are so many inspiring organizations, people here, and I really do believe that we are stronger together. And we are here to collaborate and work with you. We all have a common goal, and that is to make sure that no child suffers the burden of a hip disorder diagnosis. Thank you very much, and happy Sunday to all.
Thank you so much, Regina. And thank you so much to all of our hip health organizations for being here in person to present on the organization, submitting a video. We really appreciate your time and efforts. And thank you all for everybody who's attending today from everywhere in the world where you might be. So every year we continue to be inspired by your incredible efforts in hip health. Thank you for sharing your inspiring hip health highlights. We wish you continued success and can't wait to see what you will all accomplish in this coming year and beyond. And I am incredibly excited to see what collaboration, as Regina said, stronger together that we can bring together. And so now moving on into our 2025 Hip Legends. This is the next part of our agenda. I'm pleased to present the 2025 Hip Legend Awards. So for the 5th year, after receiving nominations from around the world, we are recognizing a number of hip legends who have long made outstanding accomplishments and contributions in various aspects of improving hip health. It's an honor to help recognize these 5 individuals for their exceptional achievements, their inspirations for us all. So before we proceed with the introductions for our hip legends, I just want to express my deepest congratulations and well done to all of you who are here to accept the Hip Legend Award today. So first up, I'd like to call upon Dr. Alex Arvold to introduce Dr. Nicholas Clark as a 2025 Hip Legend.
Hi, thank you, Emily. Professor Nick Clark has a long and illustrious career in Southampton in the UK via a fellowship in DuPont under Dean McEwen in the 1970s. Now, the first time I met Professor Clark, he actually kicked me out of his operating theatre because I was cutting the plaster cast off in the wrong way. And this is driven by his absolute meticulous attention to detail and his insistence on pristine quality practice. And this is why he is such a good surgeon and someone whose standards I aspire to maintain. And following that inauspicious start, he has subsequently become a mentor to me and a friend. And he has introduced me to Kishore, enabling me to do the fellowship in Vancouver. And he has set me on the academic career path, subsequently succeeding him in Southampton. And there are a couple of surgical training comments that he always used to use, and I continue to use, like every touch a caress, or an ounce of experience is worth a ton of knowledge. Or occasionally, when I did something well, he would say, even a blind pig finds an acorn once in a while. He has influenced countless surgeons around the world via fellowships under him, numerous invited lectures, 150 plus research publications, teaching and inspiring surgeons, and he's been involved in countless committees and organizations around the world. So I am very, very proud to call him a mentor and a friend. I'm very proud to be able to continue his legacy in Southampton, and I'm very, very proud to be introducing him today as a hip legend.
Great. Dr. Clark, if you're here to accept.
Yeah, Nick, unmute.
Can you hear me now?
Yes.
Yes, perfect.
Well, thank you. I'm extremely honored to be awarded this. I have a long career in pediatric hips, starting with DuPont with Dean McEwen, and then I've been working on hips ever since. And as I say, I'm greatly honored to be recognized, and I'm sure that I'm nowhere near as good as some of the ones that you're honoring today, but I'm pleased to accept it. Thank you very much.
Thank you very much for coming in person. Very welcome and big congratulations.
Well, thank you.
So next up, I'd like to call upon Dr. Kishore Mulpuri to introduce Maggie Manning as the 2025 Hip Legend.
Well, it's a real privilege and honor to introduce Miss Maggie Manning. Maggie currently works as a respiratory therapist in the neonatal intensive care unit at BC Children's Hospital. Maggie is a passionate advocate for accessibility and inclusion with a particular focus on hip health. Drawing from the personal experience of missed and late diagnosed TDAH, which resulted in about 12 surgeries, Maggie has become a leading voice for individuals facing similar challenges. She never let her condition define her. Maggie is a fierce competitor, and she's a proud member of Team Canada's para hockey team and our inspiring inaugural Hippie ambassador with the Hippie Lab as well as I'm a Hippie Foundation. Maggie has dedicated herself to ensuring that all kids, regardless of their ability, have a chance to chase their dreams. And her work and her efforts are truly inspiring. She's the definition of a grit, resilience, and living the life with no limits. With that, Maggie, we're honored to have you here. What you do truly inspires us, and thank you for being here.
Thank you so much, Kishore, for your touching words. This moment means more than I can truly express. Being recognized as a hip legend is not just an honor, it's a profound recognition of a journey that has shaped every part of who I am. This recognition isn't simply a title, it carries the weight of countless challenges, moments of pain and uncertainty, but also resilience, hope, and unwavering determination. My journey with hip dysplasia has been long and often difficult, yet it is precisely this journey that has shaped my purpose, and I wouldn't trade it for a thing. I've committed myself to sharing my story in hopes that in the future, children and families affected by hip dysplasia will receive earlier diagnosis, ensuring stories like mine become the exception and not the norm. My journey started long before anybody knew. Although I was born with severe bilateral hip dysplasia, it wasn't diagnosed until nearly 3 years old. At that time, there was no standardized screening protocols and no clear signs that anyone knew to look for. Like so many others, my condition quietly slipped through the cracks, unnoticed, untreated, and growing more complex with each day. What followed was a really long journey and a difficult road. Countless x-rays, CT scans, MRIs, 20 years of visits to BC Children's Hospital, 12 surgeries, hip spike casts in every color combination you could imagine, and hours of rehabilitation. But through it all, I held on to one powerful belief. Maybe my story could help somebody else. That perhaps by speaking up, I could be part of the change, a part of a future where children are diagnosed sooner, treated earlier, and given every opportunity to thrive. That belief is what has led me to the I'm a Hippie Foundation. It's where I found my purpose in raising awareness, supporting research initiatives, mentoring others, and helping to build a future where no child has to face the burden of hip disorders. To those who have walked this journey with me, this moment is for you too. I want to express my heartfelt appreciation to everyone who has supported me unconditionally. First, to my friends and family, thank you for being by my side through it all. Your love and support has carried me through even the hardest moments. To my parents, thank you for your endless strength, for being there every appointment, through every cash change and every procedure, every tear and every triumph. Your love is my safe place, and I wouldn't have been able to do this without you. And then finally, to Dr. Kishore Milpuri. Your care has truly been life-changing. From the moment you entered my life, you offered not only expert medical care, but unwavering belief in my potential. You've been a mentor, a guide, and an enduring source of inspiration. Because of you, I found strength to continue pursuing my dreams, even through setbacks. And today I have the incredible honor of working at BC Children's and Women's Hospital, the very place that gave me hope.
Mine's fine.
Thank you from the bottom of my heart for this incredible honor. I carry it with profound gratitude and with the responsibility that reaches far beyond myself. Because this journey isn't just mine anymore. It belongs to every child still searching for answers, every parent who refuses to give up on hope, and every voice wanting to make a difference. I'll continue to speak up, to advocate, and to fight for a future where every child is seen, every family is supported, and every story leads to healing and hope. Being recognized as a hip legend isn't the end of my journey. It's simply a reminder of why I started and why I'll never stop.
Thank you so much, Maggie, for that very incredible remarks as well. And thank you for your continuing inspiration to us all. So next up, we have, looks like there's a different order. So we have Dr. Shalin Shah to introduce Dr. Alaric Arugis as a 2025 Hip Legend.
Just a second. Right. It's my great honor to introduce Dr. Alaric Arugis, current president of Pediatric Orthopedic Society of India, scientific co-chair at SICOT, an active contributor of the think tank iPod, Ponseti International Global Clubfoot Consortium, and a pillar lead for the Global Hip Dysplasia Registry Network. He has always been on this path, with having trained with the hip legend himself, Dr. Johari, and having been a recipient of a gold medal during his diploma and countless scholarships beyond the scope of this introduction. With over 90 international publications, 15 book awards, book chapters, and multiple prestigious grants and awards, Dr. Arugis has played a dual role that few manage so well, having an illustrious academic career while having a clinical impact on pediatric health in India and around the world. He has done a great job at advocacy by bringing the best of global hip care to India, while also showcasing India's innovations and clinical insights to the world. His time as POSI secretary and now president has been monumental in bringing POSI to the world stage, from organizing training in complex hip procedures rarely performed in the region to bringing out research from India to the world, which guides surgeons globally, has ensured the knowledge flows in both directions. Just an example of how Dr. Alaric, along with Dr. Ruchita, were instrumental in getting together 32 pediatric hip articles for a special issue in Indian Journal of Orthopedics from best in India and around the world. It has become a great source of knowledge, almost like a textbook on DDH, including some great surgical videos like medial hip open reduction. He, along with Dr. Johari and Dr. Kanjwala, were instrumental in developing India's national CP hip surveillance and DDH screening guidelines in collaboration with 7 national organizations and along with GHDR itself, and now adopted by countless others. The care pathway was unique in terms of its incorporation and acceptance of challenges and screening in remote areas of India, and tuning the guidelines to include radiographs where ultrasound availability would be a limitation. He has also been at the forefront of innovations, both local and global, identifying and changing inherent social practices like traditional swaddling and introducing hip-friendly swaddling practices. He led one of the first clinical application of artificial intelligence in pediatric hip, a pilot AI-based TDH screening program just recently presented at POSNA. If the number of hips touched and lives changed is a metric for being a hip legend, and Dr. Rujas stands amongst the most impactful of them all, please join me in celebrating Dr. Elerica Rujas, a true hip legend.
Thank you. Thank you, Shalin, for that very, very kind nomination introduction. I'm truly humbled and blessed. And frankly, I do not consider myself deserving of such an honor to be called a hip legend. I have a severe case of imposter syndrome, being on the same platform with greats like Professor John Wedge, Freeman Miller, Nick Clark, and so many others who have been my teachers and mentors themselves. However, I do acknowledge that a large part of this honor is due to the Pediatric Orthopedic Society of India. And we did do some work on developing guidelines for hip surveillance in DDH and for hip displacement and cerebral palsy. And I'm very grateful to my friend Kishore Mulpuri, Emily Schaefer, and the entire team from the Vancouver Children's Hospital, from the BC Children's Hospital at Vancouver. And I'm a hippie, and so many other countless NGOs that helped us in developing these guidelines. I'm just a small cog in the wheel, and I'm really grateful to all of my friends and my seniors, my teachers, who have made this moment possible. And on behalf of the Pediatric Orthopedic Society of India and the countless children of India who are affected by a variety of congenital and developmental disorders of the hip, I humbly accept this award. Thank you very much for this nomination.
Thank you, Al, and huge congratulations, and very well deserved. Imposter, you are not.
Thank you.
So next up, we have some remarks from Dr. Yuri Gibbon to introduce Dr. Freeman Miller as a 2025 hip legend.
Hello, my name is Uri Givon. I'm a pediatric orthopedic surgeon at Safra Hospital for Children in Israel. I'm honored to be able to recommend my mentor, Dr. Freeman Miller, as a hip legend for 2025. Dr. Miller has been treating and researching neuromuscular hip dysplasia for several decades and has published extensively on the subject. In my opinion, he was the first developer of a real guideline for treatment of neuromuscular hip dysplasia. He has treated thousands of children, saving them from life of continuous pain by reconstructing their hip joints, trying always to prevent salvage surgery. He has taught many fellows and surgeons from all over the world, including myself, as I said, and trained us all to remember that the child with neuromuscular hip dysplasia deserves a good quality of life. He has taught many courses all over the world, always ready to come and teach whenever and wherever he was asked to come. In my opinion, he deserves this honor, and I am very happy that he has received this recognition by the Hip Hop Network. Thank you.
Congratulations and thank you, Dr. Given. Oh, yes, now we have some remarks from Dr. Miller.
I want to thank the network for the nomination as a HIP legend. It's a great honor to be recognized by the esteemed group gathered for the Hip Health Day celebration. It has been a major part of my career to focus on hip health, especially in children with cerebral palsy who often have extensive disability due to hip dysplasia and early arthritis. The Hip Hope Network has made great strides in bringing attention to the complex nature and disability which is caused by childhood hip dysplasia. The focus on childhood hip pathology has improved the research and recognition in the broader population, and I congratulate the Hip Health Network for this accomplishment. It is in this context that I'm especially honored to be considered for the nomination as a HIP legend. Thank you for this nomination.
All right, congratulations to Dr. Miller.
I want to thank the network for the nomination as a HIP legend. It's
Mara,
a great honor
we're hearing the
to be
video again.
recognized by the esteemed group gathered.
Okay. Oh.
I want to thank the network for
It's starting again. Okay, while we're sorting that out, I say next we have Dr. Simon Kelly here to introduce our final HIP legend for 2025, Dr. John Wedge.
Great. Thank you very much, Emily. Good morning, good afternoon, good evening to everybody joining this really important meeting from around the world. And it's my really great honor to introduce Dr. John Wedge as a HIP legend. So Dr. Wedge graduated from the College of Medicine at the University of Saskatchewan in 1969. After he completed his surgical education in Saskatoon, Montreal, Toronto and Oxford, he then started his orthopedic career in Saskatoon and later became the head of orthopedic surgery, the professor and chairman of the Department of Surgery at the University of Saskatchewan. In 1988, he assumed the position of head of the Division of Orthopedic Surgery at the Hospital for Sick Children, Sick Kids in Toronto. And then in 1992 was appointed the McLaughlin Professor and Chair at the Department of Surgery, also at the University of Toronto. Only 3 years later, he was then appointed the Surgeon-in-Chief at Sick Kids. And after holding and completing both of these prestigious leadership positions simultaneously, he then served as the Associate Dean for Clinical Affairs in the Faculty of Medicine at the University of Toronto and the Associate Vice Provost of the University of Toronto until 2007. Dr. Wedge has also served as the president of the Canadian Orthopaedic Research Society, and he co-founded Sick Kids International in 2006. And that was to provide pediatric specialty advisory services to international partners, and they're mostly in developing countries. So Dr. Wedge, he's an international authority on complex surgical hip reconstruction in children and adolescents. He has conducted thousands of surgical procedures, trained hundreds of residents and fellows, and has published more than 100 peer-reviewed publications. And he's been an invited visiting professor at countless countries around the world. In 2006, Dr. Wedge became an Officer of the Order of Canada for his outstanding contributions to pediatric orthopedic surgery in Canada and beyond. And then in 2012, he was awarded the Queen Elizabeth II Diamond Jubilee Medal for dedicated service to peers, community, and Canada. So I was extremely fortunate to join Dr. Wedge in my first faculty position at Sick Kids from 2010, where we shared the hip practice at Sick Kids, and that was until his retirement in 2016. I can tell you that Dr. Wedge has exceptional clinical intuition and decision-making skills. He is a master technical surgeon, and he's a very impactful researcher, but perhaps his greatest impact to hip health is his outstanding leadership with a lifelong commitment to education and mentorship of hip surgeons around the world. So I think the following personal anecdotes really perfectly encapsulate his character. So when Dr. Wedge first started transitioning his practice to me, we would go and see children together in the clinic, and he always made a point of introducing me as his partner, never his junior partner. He was empowering me and instilling confidence within the family. He would generously ask for my opinion on cases of hip dysplasia, and of course, we both knew that he didn't need my advice, him having seen thousands of cases like this in the past. Rather, he'd found a pearl of wisdom that he wanted to graciously share with me to expand my knowledge. Not a week went by when an alumnus of the fellowship program would email him a challenging case. He'd reply in detail with those same pearls of wisdom. And so he's really guiding complex hip surgeries happening all around the world from his office in Toronto. Dr. Wedge taught me every nuance of the open reduction pelvic osteotomy, be it the house favorite Salter osteotomy or the contemporary Wedge acetabuloplasty. And still to this day, in every hip case that I do, I can hear his voice in my ear guiding me as I tackle the most difficult of hip cases. So Dr. Wedge, he accelerated my academic career as he did for so many others. He invited me to join the International Hip Dysplasia Institute to be able to network with some of the greats of pediatric hip surgery, many on this call. And he conveniently made himself unavailable for high-profile speaking opportunities that he'd previously accepted and handed the speaking opportunity to me instead. He selflessly gave me a seat at the top table. It's incredible leadership and mentorship. And you can clearly see the humble and gracious way he fostered my career, and I'll be forever grateful. But if you multiply that experience by the hundreds and hundreds of residents and fellows and observers who've had the great fortune to have been taught and mentored by Dr. Wedge, you'll see the tremendous impact he's had on the hip health of literally hundreds of thousands of children around the world. So it's incredibly fitting that Dr. John Wedge has been named a hip legend. He truly encapsulates the spirit of this award. Thank you very much.
Thank you very much, Simon. Do we have Dr. Wedge?
Thank you very much. Thank you very much for that very generous and excessive introduction, Simon. I'm greatly honored to receive this award. There's one particular group that I would like to thank for my education, and these are the First Nations people of Northern Saskatchewan, who in the 1970s taught me what an outcome should be from surgery compared to how they functioned without having had any treatment previously. And it was apparent to me at that time that those that were receiving surgical treatment were not faring as well as those who did not. And it was a great stimulus for me to begin to work out methods that produce more consistent results. I also had great mentors in Professor Salter and many others in my surgical career. I'm grateful to all of these people too. So I have a lot to be thankful for in addition to this marvelous award. Thank you.
Thank you very much, Dr. Wedge, and huge congratulations to you, and congratulations to all of our 2025 HIP legends once again. So well deserved, and in such an incredible group of inspiring individuals in this group. And thank you to everyone who submitted nominations as well. So to our HIP legends, your efforts and achievements are truly inspiring to us all. And we are also incredibly grateful to all the hip health organizations who shared their stories and their goals with us today. That's leaving me particularly inspired to continue with some of the work that we are doing and hopefully finding new partnerships and new collaborations where we can truly build something remarkable globally together. I can see a lot of room for that in the groups that are here today, and a lot of synergy between some of the care pathway work that we are doing and the patient engagement work that we are doing alongside the registries. And so with the inspirational efforts of the global hip health community in mind, I would like to pass it to my colleague Tamara Dudley to talk about celebrating your HIP squad this Hip Health Day.
Hi, everyone. So in the continued spirit of gratitude and excitement for the global hip health community, and just to also help continue to spread the awareness about hip health efforts from local to global and back to local again. I'm going to encourage all of us to celebrate this Hip Health Day by posting on our social media platforms and celebrating our hashtag Hip Squad. So who is your Hip Squad? Well, all of us have one. It is the group of people who are supporting you in your efforts in hip health. So whether that's the clinicians you work with, the group of volunteers that is in your patient advocacy organization, researchers you work with, your colleagues, the funders that support your efforts, the patients, your family and friends who are supporting you. There's a huge, amazing community. So we're all hoping that you can give your community a shout out using the hashtag Hip Squad. And we'll give it a bit of a boost through our social media channels at our Hip Hope Network. So if you're active on social media, please give a shout out to your Hip Squad there. And speaking of Hip Squad, it's time for a group picture. What an incredible Hip Squad this is. We had registrations from all over the globe. I'm sure that this group here represents an incredible force within the global hip health community, and we sure appreciate all your efforts. So at this time, I invite you all to turn on your cameras if you would like to participate in a group picture. It will take probably a couple of shots within the Zoom gallery, and we'll take a few photos of the whole group. Thanks. So wonderful to see all your smiling faces. So if I can get Rachel and Tarani to take a few shots while we're all smiling here, that will be great. Okay, I'll say 3, 2, 1, cheese. 3, 2, 1, Hip Squad. 3, 2, 1, Hip Health Day. That should be great. Thank you so much, everyone. And if I could ask as well for our amazing hip legends and the folks who introduced our hip legends, if you could stick around for a few minutes after we wrap up, I would love to get a group photo of all of you as well. So I will hand it back to Emily Schaefer, our host for the day. And thank you so much.
Thank you, Tamara. And at this time, I'd like to acknowledge and thank the kind and generous support that enables the Hip Hop Network, especially from two key funders, the Peterson Group and the I'm a Hippie Foundation. We are so humbled and honored by all of your support, and what we're able to do on Hip Health Day and throughout the year is directly thanks to you and your support. So please accept our deepest gratitude and appreciation. And so finally, this overall concludes our 5th annual Hip Health Day gathering. Thanks again to all of our presenters and hip legends, and a huge thank you to everyone who joined us from all around the world. And a big thank you to our Hippie Lab team in the background, led by Tamara Dudley, putting this event together for the 5th straight year, and numerous others. I know Rachel's one of our WorkLearn students, and Tarani in the background, and Joel getting things ready. So thank you so much to our internal team as well. And with that, I just wanted to hand it back to Kishore to do the final closing remark, and then we will let you go about your mornings, evenings, afternoons, wherever that may be.
Yeah, I think first of all, thank you all for being here. This is a huge honor, I think, to see so many colleagues and patients and families that are joining us from really all around the world. And one big shout out, I think the person that deserves a special shout out is Tamara. As you can see today, schedule is planned for an hour and a half. And we just had 26 transitions and presentations built into this 1 hour. And Simon Kelly actually said, well, I don't know if we can get the introduction after Dr. Wedge done in time. Simon, you've done a great job. Even Dr. Clark, who was struggling with technology, got his job done. So all of that done in 60 minutes. I think this is incredible. 26 different transitions and presentations. And the planning for this starts months in advance. And Tamara does an incredible job. And she's been texting, emailing our team right through the weekend. So Tamara, thank you so much for everything you do. You've really transformed this network ever since you started with us. And you're really actually the heart and brain behind, I think, how Hip Hop Network is working and moving forward. So we sincerely thank you, I think, for your efforts. And there are lots of patient families that have joined us here today, and we are doing a lot of patient-oriented research. Emily and Bren have had a master's student that worked with us on lived experience of patients with DDH and bringing patient groups together. We're partnering with, Emily is going to work with Lauren and others in really looking at, again, lived experience of adults with DDH. That's coming down the road, so stay tuned for that. And I think it'll be an effort that we would involve all of the different organizations that is working with us. I think you may have captured that one word that Regina said: we're stronger together. We believe in collaboration, not a competition. We're all working towards a singular goal of improving hip health of children and families all around the world. We're doing a lot of other advocacy work. We're working with UNICEF in India, trying to implement the care pathway that Al led with Posey to develop that. And I've been meeting with the head of UNICEF in Kenya in a couple of weeks to see what efforts we can do in Africa. And we certainly learn from all of you. And that's the reason why we create this global community. We all, each one of us are doing our own efforts locally, but I think together we can improve care globally, learn from each other, and bring those global learnings back home to our own settings. So thank you all. I know we covered the globe in terms of, I think, where you're all joining from. And that shows for some of you, it's late in the night, and some of you, it's really early hours. And you've joined to celebrate this day. Do post pictures through next week and tag Hip Hop Network and Hip Squad and your own different organizations. So let's all celebrate hip health of children around the world. Let's all work together so no child suffers from the burden of late diagnosis. Thank you. Look forward to seeing a lot of you in the coming months or virtually. And we're just a phone call or a text or email away. So do reach out to us, and looking forward to talking to a lot of you soon. Thank you. Have a great rest of the day. And as Tamara said, if the HIP legends and their nominators and the presenters, if you could stay back for one quick picture. Thank you.
Thanks, everyone.